If you are taking opioids after surgery, you will eventually need to slowly reduce and stop taking them. This is called tapering. If you take opioids, you may fall into one of three categories. Short-term use, estimate less than 2 weeks. If you take a low dose, such as 3 or fewer pills per day for less than 2 weeks, you may be able to stop taking opioids without tapering. In most cases, the body has not yet developed a tolerance. Medium-term use, estimate between 2 weeks and 6 months. For medium-term use, the CDC recommends decreasing opioid use by 10% per week. Long-term use, estimate more than 6 months. For long-term use, the CDC recommends decreasing opioid use by 10% per month. After surgery, you should take opioids as needed. After first trying non-medication methods of pain relief, such as ice, relaxation, and changing position, and non-opioid pain relief medications approved by your surgeon. For medium-term and long-term opioid use, tapering will help you stop taking opioids safely and comfortably. So how does opioid tapering work? The key to opioid tapering is, first change the dose, then the interval. The dose is the number of pills you take at a time. The interval is the number of hours between doses. An example of changing the dose would be gradually reducing 2 pills to 1 pill over time. Once you are taking the lowest possible dose at every interval, gradually increase the length of time between doses. For example, taking medication every 8 hours instead of every 6. Continue lengthening intervals until you no longer need to take medication. Should you need to, ask your medical care team for personalized advice on how to taper. If you follow CDC guidelines, it is unlikely that you will experience noticeable withdrawal symptoms. However, if you do experience withdrawal symptoms, talk to your doctor. Withdrawal symptoms may include flu-like symptoms such as sweating, chills, or aches, rapid heart rate or headache, fatigue, anxiety, or trouble sleeping, nausea, vomiting, or diarrhea. Do not use alcohol, sleep aids, or controlled substances to help cope with opioid tapering. As always, ask your medical care team if you have any questions or concerns about opioids.